Thank you very much. So yeah, my name is Bojan Pirnat, and I have first disclosure is that I have mild hemophilia A. I was diagnosed at 6 years old when we immigrated to Canada in 1996, and I initially tested at 19% factor, so a huge amount. But before I start in on my presentation, I just want to say very quickly and to disclose that I've never had a joint bleed into my joint, and I'm extremely lucky that that's the case. I've had muscle bleeds, and I've had many different issues around my hemophilia, but that definitely hasn't been one of them. However, I hope that despite that, I'll be able to give a bit of a mild perspective today here from the developed country point of view. The other thing, too, is I know I'm going to be talking a bit about pain, so I'm just going to apologize ahead of time to anybody who doesn't have access to treatment and factor. I just want to remind you that I'm speaking from personal experience, and I do appreciate that there's a definite spectrum and in terms of the access to factor, and that I've been very lucky to have that access. Two other disclosures very quickly that might be particular to my case and may make it slightly uncommon with mild hemophilia is that I was tested and found slightly lower hemophilia B rates, so I'm at about 60%. I have hypermobility in my joints, which makes them less stable and more likely to bleed in a situation where I'm exercising or doing high impact sport. And that should pretty much cover it. If you want to know, I have a little bit of a connective tissue issue as well. So if I get cut, it's very hard to stop bleeding even after factor administration. All right, so here I go. Hope I don't disappoint you too much after this. I'll start by talking a little bit about my adult life as it is now, and then I'll build up to that with a bit of a chronological presentation on how I went through, since I honestly haven't had a major bleed, with one exception, since 2015. And a lot of that has come out of the conscious choice not to be involved anymore in high-impact physical activity. And part of that is also because as a mild hemophiliac, I'm not on prophylactic care, I'm on on-demand treatment. So on-demand means, I'm sure everybody knows, but it means that I treat only when I have an injury, and sometimes as a mild hemophiliac and with lower experiences, less frequent experiences of bleeding, it's hard to tell when I am bleeding. And sometimes that's led to controversy in trying to talk to the team and for them to figure out what I'm doing that is causing these issues. But that said, they've all been extremely supportive of me over the years and tried to help me to find a way to find a tailored program for me. So another reason that my bleeds have been lower is this extreme care that I've been taking as a result of living away from my family in Toronto. I moved away from Manitoba for school to do my master's in political theory. And since then, I've been very cognizant of the fact that I'm pretty much alone out there. And that means that I have to, take care of myself, and that's led to trying to be as careful as possible with the way that I approach my bleeding disorder. Unfortunately, that's meant sacrificing exercise, even though I know the extent to which exercise is important to maintaining healthy joints and healthy muscles, and lowering the frequency of bleeds in the past. And for what it's worth, I am noticing now a slight uptick in situations where I'm bleeding because probably of the fact that I'm out of shape, quite simply. But that said, my day-to-day reality does involve pretty much chronic pain in my muscles, in my knees, in my ankles, and in my lower back, which was the one major injury I had while at work. And this was a big issue because it's just, I can't risk injury with trying to build a professional career. And although we are technically protected in Canada in terms of these things, it's not quite that simple. And employers who don't have experience or are smaller employers don't understand their legal responsibilities related to, I'm just asking 1 second just for time, how am I doing? Excellent. Good stuff. Hopefully I'm not talking too fast then. So being on WSIB is an interesting experience because I was desperate to get off of it, and that's Work Safety and Insurance Board, I think. in Canada, which is for when you get injured, compensating your employer and compensating you. And so trying to figure out a way to navigate that and the relationship with my employer was an interesting experience, but ultimately, after a bit of tension, we were able to come to a compromise, and I was able to continue working there for a while, though I am currently seeking new job opportunities. So when I try to exercise and when I try to regulate my hemophilia, what I notice is that my muscle aches, even after a long period of working out, stay, and they continue throughout. So it's a 7-day turnaround, which means that if I'm constantly working out, there's never an end to that pain, which is, I know if you've ever been an athlete and involved in high intensity exercise, that pain from muscles is a common thing, but the degree to which I feel it causes a serious amount of anxiety about whether or not I'm causing bleeding and how severe is the pain from the muscle exertion. Is it actually a bleed, or is it just something I have to push through, and it's hard to know which one of those is the case. So with that said, those are the current challenges that I'm looking at, but now I'm going to go through a bit of the chronology of my illness. So I've always been on on-demand treatment, and since I was diagnosed in 1996, I've been on on-demand, and for the most part, it does its job, especially when I was a kid, since we had the factor first policy in Canada. When I would be injured, which was infrequent, I would hardly ever take more than 1 or 2 treatments to solve an issue. And that allowed me to do a lot of things that other kids with hemophilia couldn't, which is be involved in high-impact sports and even to be involved in martial arts. And I know what you're thinking, but it was officially approved by my HTC. So they came to a compromise with me. They thought I was a pretty serious kid, and that I was going to take care of myself and manage myself, and they had confidence in me, and I was able to do that without treating beforehand. But as I came to the transition point, which I find is a very complex point in every hemophiliac's life, of puberty, as the muscles start growing, your body gets stronger, and your hormones start to do weird things to your brain where you stop processing risk. Obviously, I was interested in doing more like what other kids were doing, and part of that was continuing with the martial arts, and because it did have a huge benefit for me. Part of the reason I think that I was bleed-free for a long time was that I was constantly involved in activity. But that changed when I started to do track and field. I was quite good at 100-meter sprints, 200-meter sprints, but that's a huge strain on the body, and at that age I wasn't able to be serious about being more careful about the way that I approach this. So eventually what that led to was a vertical tear in my muscle on my quadricep. Can you still hear me? Yeah. From the knee all the way up to the groin. And it was serious enough that it led to compartment syndrome, and thankfully didn't have to be surgically remedied. But with quick intervention from my team, after realizing we were able to handle it, though it took about 6 months to recover. But this basically set me on, this was my first real experience of pain in a real way, because the physiotherapy at that time, this was around 2003, 2004, in order to keep permanent muscle damage from happening to my left quadricep, what we did was they put me on my stomach on the chair. And the way that they would do it is one physio would put their hands on my back while the other took my ankle in one hand and put their other hand on the back of my quad and slowly pulled it up, allowing the dried blood in my muscle to break apart and allow blood flow to go through so that the white blood cells didn't eat through my muscle.
You have 1 minute.
Oh, perfect. And I just started. So to kind of speed through this, anyways, that recovery took 6 months, and it had a huge impact on me, as well as the way I processed pain. It took 2 full years to be at a point where I felt completely like I was at 100% of what I had been before. But things only got worse as I got into my teenage years and into high school, where I was moving away from infrequent bleeding to bleeding at least once every 2 months. And I would lose on average between 20 to 30 days of school every year, which then moved on to, in my last years of high school, between 2007 and 2009, probably between 30 and 50 days each year that were lost because of serious ankle bleeds. Those started when I fell, actually, unlike most people, going upstairs, not downstairs. It was quite wet and slippery. I put a foot down, and on the way, I started to fall backwards as I slipped. And to stabilize myself, I planted that left foot, and instead of falling back, I twisted 360 degrees around my joint, which thankfully didn't break my ankle, but damaged all the ligaments and tore some of them in that on the way down. And then additionally, I fell down the stairs and hurt myself. That started off like that. Damage created instability in my joints and a difficult recovery process where diligent physio meant that I was trying to deal with this and use the exercises I was used to in my high impact sport to fix this problem, but trying to build back up was very dangerous and often resulted in rebleeding. In fact, because my body was getting stronger and stronger, and I was in a sport that was extremely ballistic, you'd use your legs a lot to kick out. So I ended up causing psoas damage, and milds generally don't have psoas bleeds, but I had one on the right-hand side, and the psoas, if anyone doesn't know, is a huge muscle that goes from your groin, wraps around to your back. On the right-hand side, and then quickly had one on my left-hand side as well afterwards. So then I got into this weird cycle of ankle psoas, ankle psoas, ankle psoas, ankle psoas, going back and forth for a little while until I was in university, and I just decided I've got to stop doing high-intensity exercise if I want to be able to have a normal social life and be integrated into my...
Summarize, sorry.
Oh, yeah, so I wasn't there. I apologize. So yeah, basically what it led to was trading one thing for another instead of continuing with exercise in order to give my joints and my muscles a break. And that was my experience. Some of those things have had long-term effects, as I spoke about at the beginning of the talk. And the conclusion I want to make is that I wonder if in certain cases in a country like Canada, whether prophylaxis for mild hemophiliacs in certain cases would be the best way to go. Thank you for your time.